Hey everyone, I'm going to share 3 common myths related to joints. Number 1 is going to be that we're double jointed. We don't actually have 2 joints or an extra joint in that area, like in the elbow or the wrist or the thumb. People say, well, I'm double jointed. I can bend all the way back. I'm double jointed. What you have is increased laxity within that joint space. And so those ligaments, tendons, muscles, the connective tissue around the joint, the capsule itself, may just have increased pliability where it can move or be stretched more than, say, the average person's joint. So double jointed is just a myth. Number 2 is going to be using the lubricant that's used a lot of times by mechanics, or you're spraying that squeaky door at your house. It does not lubricate the joints. It doesn't really work to penetrate down. I know for years people have sprayed that on their joints and will swear by it, saying that it works. So if it works for you, then, by all means, whatever. But there's no hard scientific evidence that supports that spraying on your joints are going to lubricate those joints. And the last one, which is probably the most common one that I've heard, popping your joints is going to cause early onset arthritis. So we all know people that pop their joints. I pop my joints. We have patients, practitioners pop joints on patients, whether you're a therapist or an osteopath or a chiropractor. A lot of times there's, joint popping or some of that cavitation happens. And so there's been studies with that do not support that if you pop your joints, you're going to cause arthritis. So I know we've heard for years, don't pop your joints, you're going to cause arthritis. Just know that there's no evidence that supports that you will, in fact, develop arthritis or an early onset episode of arthritis just by popping your joints. Now, I'm not saying to go out and do any of these things. I'm just letting you know what the research says. Thanks for watching.